Chronic lower back pain. It's one of the top reasons people go to the doctor. And for millions, it's this relentless, just frustrating part of life. You do all the stretches, you try the therapies, but that pain just sticks around.
And that's the question, right? The one that echoes in clinics everywhere. You've probably been told it's just nonspecific, a super vague diagnosis that gives you zero comfort and, honestly, no clear way forward.
But what if I told you there's often a very specific identifiable clue for that pain? A clue that's been hiding in plain sight on MRI scans for years, but has been at the center of a really intense debate. So let's play detective and take a closer look at this controversial clue. What we're talking about here is something called Modic changes. Think of them as a key piece of evidence in this whole mystery of chronic back pain.
So what are they exactly? Well, simply put, Modic changes are actual alterations in the bone marrow of your vertebrae. Okay, so picture this. Your spinal discs are like these little cushions, right? And the vertebral end plates are the hard, bony surfaces just above and below those cushions. Modic changes happen right there, in the bone, next to the cushion. This isn't a muscle strain or a slipped disc. It's a fundamental change to the bone itself that shows up really clearly on an MRI.
All right, now that we've identified our clue, let's build a profile. What do these changes actually look like, and who's most likely to have them?
So Modic changes get broken down into 3 types, and you can almost think of them as a progression, one leading to the next. Type 1 is what you could call the angry active stage. It's got swelling and inflammation in the bone marrow. Then in type 2, that inflammation starts to get replaced by fatty tissue. And finally, type 3 is where the bone actually hardens up, a process called sclerosis. The main thing to remember is that these probably aren't 3 separate problems, but more like different acts in the same play.
And get this isn't some rare, obscure thing we're talking about. A major meta-analysis found Modic changes in a staggering 35% of patients with lumbar spine issues. I mean, that's more than 1 out of every 3 people seeking help for their back. This is not a minor detail. It's a widespread phenomenon.
That same huge analysis also helped clear up what does, and importantly, what doesn't, put you at risk. And this is where things get really interesting. Over on the left, you see the culprits you'd probably expect. Getting older, disc degeneration, and physical damage to those end plates. But now look at what's on the right. Factors we hear about all the time in relation to back pain, like your BMI, smoking, and even a disc herniation, were not found to be significant risk factors for developing these specific changes. And that's a really crucial distinction to make.
And this chart just drives that point home. I mean, look at that. Disc degeneration is, by a massive margin, the strongest predictor. If you have it, you are over 8.5 times more likely to also have Modic changes. Sure, age and end plate damage are significant too, but nothing even comes close to the impact of a degenerating disc. Now, you'd think that if these changes are so common and linked to such clear risk factors, the case would be closed, right? Well, for decades, the scientific community was actually deeply divided on this.
And this really is the central question that has puzzled researchers and, frankly, frustrated patients for so long. How could something you can see so clearly on an MRI have such a murky, debatable connection to what a patient is actually feeling?
Well, the answer really lies in the research itself. As a 2023 review pointed out, the early studies were, to put it nicely, kind of a mess. They were lumping together all sorts of different patients, people with acute pain, chronic pains, scoliosis, herniations, you name it. It created this incredibly confusing picture where the real signal was just lost in all the noise. And the result of all that confusion? A widespread belief that the link between Modic changes and pain was weak, inconsistent, and maybe not even real. For a lot of doctors and patients, it just became another ambiguous thing you see on an MRI, not a clear diagnosis you could do something about. But that has all started to change. Recently, new research has brought stunning clarity to the picture, and it's because they started looking at very specific patient groups.
By studying these more homogeneous groups, like only patients with chronic low back pain and type 1 or 2 Modic changes with no other issues going on, the true connection finally started to pop. And the proof didn't just come from observing them, it came from a really groundbreaking treatment.
So let me introduce you to basivertebral nerve ablation, or BVNA for short. This is a procedure that targets the very specific nerve that carries pain signals away from the vertebral end plate, the exact location where Modic changes live.
You can think of it like this. If you suspect a specific wire is causing a short circuit, cutting that one wire and seeing the problem vanish is pretty definitive proof.
BVNA was the smoking gun that researchers had been looking for.
And the results? They were nothing short of remarkable. Clinical trials showed that after 12 months, 75%, 3/4, of the patients who got the treatment reported a really significant reduction in their disability.
And this right here is the crucial takeaway. The success of a treatment that only targets the nerve from the affected area provides direct interventional evidence. It proves that for so many patients, the pain is not non-specific at all. It's what we call vertebrogenic. It's originating from the vertebra itself.
So, what does this all mean for the millions of people living with chronic back pain? Well, it signals a potential paradigm shift in how we diagnose and treat it. It's a huge step forward.
So, let's just quickly recap the big points. First, Modic changes are incredibly common, found in over 1/3 of cases. Second, all that historical confusion about their link to pain was really just due to messy research. And most importantly, thanks to targeted treatments like BVNA, we now have powerful proof that these changes can be a direct source of real pain, which transforms an ambiguous MRI finding into a truly actionable diagnosis.
Which leaves us with one final, pretty provocative question. As we get better and better at identifying specific pain generators like these Modic changes, are we finally moving past that frustratingly vague diagnosis of non-specific back pain and into a new era of more precise, more effective care? The evidence is suggesting that we just might be.